Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then try to take actions to make a better system for all of us. Today, we're going to talk about the loss of doctors, OBGYNs in particular, in Idaho. But before we do that, down below in the description box is a link to the Healthcare Advocacy newsletter, and all of the links that I discuss, the stories, the radio programs, the scientific analyses, and the actions for us to take are all in that newsletter. You can, of course, subscribe for free and have this delivered to your inbox every day. So let's get started. According to MedPage Today, Idaho has been losing practicing obstetricians since the abortion ban in that state took effect in August of 2022. According to a new report by the Idaho Physicians Wellbeing Action Collaborative, they compiled the data. And of course, there should be a link. The report showed 22% of the practicing obstetricians in Idaho stopped practicing or left the state during a 15-month period from August 2022 to November of 2023. In total, the number of obstetricians practicing in the state dropped from 268 to 210 during that period. The report also noted that 2 hospital obstetric programs closed during that period, and 2 other programs are struggling to remain open due to problems recruiting obstetricians, including one that's expected to close April 1st. In fact, in the Healthcare Advocacy newsletter, we reported on this last year. There was an interview with the director of the program, and he was so frustrated that he just couldn't get people to show up to take a residency in Idaho. Many obstetricians are trained in the care of high-risk pregnancies. This is so important. And when you lose obstetricians, you lose the ability to care for people who have high-risk pregnancies, and you lose the ability to have access to emergency obstetric care, including emergency cesarean sections. There's more. Another report found that the majority of Iowa's rural hospitals no longer have labor and delivery services. The Center for Healthcare Quality and Payment Reform analyzed federal data, and they found, as of January 2024, 61% of rural Iowa hospitals no longer have OB care. And of the 36 hospitals that remain, rural hospitals that remain, that are still providing care, 58% were losing money on patient services overall. That's according to Iowa Public Radio, and of course the link to the radio story is in the newsletter. Look, return to the good old days. The good old days weren't that good if you can't get to a doctor. Let me point something out here. The longer a pregnant person has to take to get to an OBGYN to deliver the baby, the higher the rate of maternal mortality and infant mortality. And that's just the way it is. And the cruelty that Idaho and the other states that have banned abortion have inflicted on women is just unconscionable. You already know what the answer is. Restore the right nationwide to reproductive health care and the ability to purchase abortion medication nationwide via telehealth. Let me give you those bills. That's the Women's Health Protection Act, H.R. 12 or Senate Bill 701, which restores the right to an abortion nationwide, and the Protecting Access to Medication Abortion Act, H.R. 767 or Senate Bill 4467. Look, here's an action we can take, and I'm sure our members of Congress get tired of hearing it, but you know what? They need to think their jobs are on the line unless they do this stuff. So let's keep letting them know. You can call or email your member of Congress and senators and remind them to pass the Women's Health Protection Act and the Protecting Access to Medication Abortion Act, and to help make sure medicine is available for abortion, which is used in 53% of all abortions nationwide. Their contact information is down below or in the resource section, or you can use ResistBot, my favorite way, to send the email I'm going to read to you on your cell phone. Just send a text message to 50409, and here's the message: SIGN, 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 space, PPOTTE. And here's what you'll be sending. I'm your constituent, and I'm shocked to learn that 22% of the obstetricians in Idaho have left the state. The ability to get a doctor quickly for women is disappearing in states with abortion bans. Moreover, if you have a pregnancy with complications, your ability to have it successfully managed are declining rapidly because those that are leaving the state know how to treat those emergencies. More than half of all rural hospitals in Idaho no longer deliver babies. Look, you already know what the answer is, and it's becoming more critical every day. I want you to do everything in your power to pass the Women's Health Protection Act and restore the right to an abortion nationwide with the Protecting Access to Medication Abortion Act. Making sure the medicine is available. For me, this is a critical issue, and I promise I will remember how you behave at the next election. Okay, let's go on to another subject, measles. I'm old enough that, measles isn't too much of an issue anymore for me. I already had it. However, the Florida Surgeon General chose to recommend that unvaccinated students attend school when there's a measles outbreak. This is apparently pandering to the "you can't make me" crowd who are willing to put their children at risk. He did this instead of following CDC guidelines that recommend that unvaccinated children stay home. The Florida measles outbreak is now expanding. On Friday, that's February 23rd of 2024, health officials in Broward County confirmed the seventh case of the virus. It was a child under age 6, I think. The patient is the youngest so far to be infected with the outbreak, and the first identified outside of Manatee Bay Elementary School in Weston near Fort Lauderdale. Cases are not going to stay contained just to that one school, not when a virus is this infectious, said Dr. Davis Kimberlin, co-director of the Division of Pediatric Infectious Diseases at the University of Alabama, Birmingham. Across Florida, about 10% of children are not vaccinated for measles. Since each person has the ability to infect, on average, about 18 unvaccinated people, having a high percentage protected is important. That's what's called herd immunity. The herd immunity is usually achieved at a vaccination rate of about 95% or better. Michigan has also reported its first outbreak of measles since the 2019 outbreak. Measles has also been reported in Minnesota, according to public radio there. Look, the MMR vaccine, that's measles, mumps, and rubella, is incredibly safe and effective and is widely available at almost all commercial pharmacies. If you've got a kid, make sure they get a vaccine. Okay, that's what I've got for you today. Down below, you can like, share, subscribe. You can get the Healthcare Advocacy newsletter. Send comments to me in the comment field, or you can send them to healthcareadvocacy1@gmail.com. Have a good day. We'll talk later.